Mission Health. Be well, get well, stay well.
Good evening. It's good to have you here with us tonight. My name is Bill Hathaway. I'm the Chief Medical Officer of Mission Health System, and it's a pleasure for me to be the host of our third in a series of Facebook Live presentations where we discuss Mission Health's recent decision to partner with HCA out of Nashville, Tennessee. It's a pleasure, as I said, to be here. I'm glad that you're here to join us tonight, and we hope that we'll have a nice and lively and interesting discussion where we discuss the aspects of this transaction, why we chose to do it, and some interesting things that came from a site visit that we recently had a few weeks ago. I'd like to introduce the people who are here with me tonight. We have Dr. John Ball, who is the chair of our health system board at Mission Health. I have to my left Jill Hoggard Green, who is the president of Mission Hospital and the chief operating officer of our system. Janice Brumit sits on my right. Janice is a dear friend of mine for many years and a native of Western North Carolina. Janice has the privilege of serving as the inaugural chair of the Dogwood Health Trust, something you'll learn about in detail tonight. One of our major purposes of having our conversation tonight is to share that conversation with the community. And then my partner in crime at Mission Hospital, our Chief Nursing Officer, Karen Olsen.
Thank you.
Thank you, and I appreciate all of you joining me tonight for what I think will be a fun conversation.
Yeah.
And we appreciate having the audience on our Facebook feed to join us. As I said, this is the third in one of our conversations. The first two conversations focused on some of the material aspects of our transaction, why we made the decision. We'll touch on that a little bit briefly tonight, but then what we hope to get into detail about our conversation tonight is a recent site visit that we all had the opportunity to participate in to Austin, Texas, where we learned about a health system called St. David's. And we're excited to share that conversation with you. As you watch us tonight, we want you to participate in this conversation. We have the opportunity to take your questions, and we hope by the end of the hour-long session that we have scheduled that you'll be able to send those questions to us via the Facebook comment section that you're looking at on your computer or mobile device screens. So please send your questions. We'll do our best to answer them. Any questions that we can't answer or don't get to, we will try to post on our website, missionhealthforward.org. That's missionhealthforward.org, and you can get all kinds of information about the transaction and what we're about and what we're trying to investigate as we go forward in this partnership. I want to start briefly with a question for you, John, if you'd help us out. This is a big decision for Mission Health. I think many people in the community, and certainly those on this Facebook Live feed tonight, are aware of our decision to explore a partnership with HCA. Healthcare is an ever-changing field, and I wonder briefly if we could just set up tonight's conversation with some of the compelling factors that drove us to make a partnership and why we chose HCA.
Well, the first and most important one is we wanted to make sure that health care of the quality that people have come to expect, affordability that the people have come to expect, and accessibility that people have come to expect would continue in Western North Carolina for years and years, if not decades and decades to come. Mission is over 100 years old. We hope it to go on for another 100 years. So the first part of the transaction in the sale to HCA Healthcare is to assure that people get health care. But there's a second and almost equal component to the transaction, which is the formation of a substantial foundation which can help people prevent getting sick by looking at what we call the social determinants of health, the economics, education, transportation, issues like that. So one of the reasons that we went to Austin to look at St. David's Health System and St. David's Foundation was to look at those two components. How did St. David's, which made a transaction with HCA Healthcare years ago, achieve what it did as a hospital or health system, and what did the foundation achieve that was a spinoff of that transaction as well? So the reasons that we went is to see, what can we learn from the culture there? What can we learn from what the foundation did?
And they're an old health system that was in existence for many years. If I recall correctly, they joined HCA in 1996, is that correct?
Yes.
So a mature relationship with HCA.
Yeah.
Good.
So we were able to question them, did HCA keep its promises? And the answer was absolutely. And Jill and Karen will go into that further.
Yeah, and I think it's important. And I think the other thing you touched on that I think we should emphasize to our viewers tonight is healthcare is in a wildly changing dynamic, a lot of uncertainty. I think many people were surprised that we took a partner. What were the driving forces behind taking a partner in the first place?
Well, part of it is we looked at what our market is here, and we've always talked about the math problem we have. 75% of our patients are covered by either Medicare, Medicaid, or self-pay, and none of those three pay actual cost. And then so 25% of our patients are covered by commercial insurance. 75% of that is covered by one commercial insurer, which is unwilling to give us what we need to carry the rest of the load. So what we were looking at is cut cost every year, which ultimately meant we'd have to cut programs, clinical staff, and that sort of thing. We didn't want to go there because we wanted to keep quality what it is now and accessibility and affordability what it is now. And this gave us the best chance. As you say, nothing's certain, but we wanted to give this community the best chance it could have to have affordability, quality, and access.
And so, as I remember, we signed a letter of intent in March, and that was our decision to explore a relationship with HCA after exploring many health systems. And we've talked about that on earlier Facebook presentations, so we won't go into that in a lot of detail. But I think it's important to emphasize that it was a careful and well thought out decision by our board. And Janice, you were part of those conversations.
Yes, yes.
So we picked HCA, and I think many people were surprised a little bit about the fact that we picked a for-profit partner. But we had this tremendous opportunity. Tell us some of the conversations that went. Jill, if you have some comments about that.
Absolutely. It was wonderful to visit St. David's, and for the reason you said, John, is that they chose to become a partner with HCA about 20 years ago. So for Janice and her team, they were able to look and be up and close and personal with how does the foundation actually serve the community. And for Karen and I and Dr. Susan Mims and Bill and others, we actually got to get up close and personal to see how are they actually delivering the care. We knew that St. David's, if you look at their data, you'd know that their outcomes are really good for patients. But it was really important to Karen as our CNO and Ruth Sarai and Dr. Susan Mims to actually get a feeling of how are the physicians and the nurses and the whole teams working together? And are they really providing the compassionate care that our community has come to know and expect and trust? And I'm delighted to say we saw it. And one wonderful story right at the beginning of our site visit, and we spent 2 days in the hospitals. We came in the wrong door, and so they weren't there to greet us. And the wonderful person who did greet us said, we'll take care of it, we'll find your team that are going to help you see the rest of the hospital. A volunteer walked up to me, a gentleman probably in his 70s, and he said, I'm going to tell you about our hospital, and immediately said, I had a heart attack, and the folks here at St. David's, they took care of me. I had open heart surgery, and they did such a good job for both me and my family. I knew I was at the right place and in good hands. So he said to us, unprompted, so I decided when I retired, I had to give back, and I'm a volunteer here 5 days a week because this is my hospital. Those kinds of stories and those kinds of experiences really got us a sense of they do share our values, that patients are at the center.
I think I'm really anxious to hear more about those kinds of stories that we learned there. Before we dive into that, I'd like to hear just a little bit, and I think people in our viewers are interested in learning a little bit. Why did we pick St. David's? HCA has 180 hospital systems. They have many ambulatory surgery centers. They're a very diverse organization. What was it about Austin and St. David's that we chose to go there?
St. David's is actually the hospital, the health systems, there's 3 hospitals, are very similar to Mission. If you look at the programs they provide, the acuity or how sick patients are, they actually match us quite well. So we wanted to see a hospital that was taking care of a large population, taking care of everyone. They have a large number of individuals that are uninsured or on Medicaid. They have access for all. So we chose them because first, they were very similar to us, so we could get a good sense. And then, as you described, John, they developed a foundation 20 years ago. So I know that Janice and the team wanted to see a place where it had matured so they could really test, how are we meeting the needs of the community?
And Jill, just to that point, I remember when I had the opportunity to share with some of the nurse leaders there, and what we saw with the staff and with the leaders, that many of the very things that we are working on, that they were also embarked upon. I think about the rooms that we saw, the renovations. It's very similar to what we're building with our Mission Hospital of Advanced Medicine. They have a beautiful area for the family, the caregiver, and the patient, the zones that we're embodying. They also have a patient and family advisory council that they use. And so many of the things to ensure not only the quality, but that we really focus on that patient and their family's experience. So it was very much about exchanging ideas and best practices. And there's some things I learned and some things that we shared that we do that they learned from as well. So it was very positive.
So it sounds like, in addition to seeing what their facilities were like, there was an interest in learning about their culture and how the local folks were able to interact with the corporate folks at HCA.
One story, Bill, that was very eye-opening as we toured one of the hospitals, and I think we were down close to the rehab section of the hospital, and David was with us as one of the leaders, senior leaders for the division. And there was an EVS employee, environmental services person, who squealed, "David!" And he turned around and came up to him to give him a very warm and welcoming hug. She had not seen him for a while, and they exchanged, "Well, how's your family?" There was an approachability and a real genuineness that touched me, and I thought, this is what I needed to see, to have a comfort that this is the right thing. It felt good.
Did it feel like mission?
Yes, very much.
Yeah.
If you go down our halls, I think you would see the same thing happening with many of our leaders, and you see it, I see it, and it resonated.
I think that's one of the biggest concerns that people have expressed to me is, we went to, they're a unique and separate health system. We look to see the kinds of similarities. They deliver care that's unique to their market in many ways. But the thing that we'll definitely share in common is a relationship with HCA. And so I'm very interested in hearing everyone's thoughts about how they came away from that visit feeling that our interactions with HCA would be in the future.
Time and time again, I was with several teams, and they talked about the support they were getting from HCA. They felt like they were very focused on their community. There were some unique needs that they had within their community, and they were developing programs around that. But they talked about how nice it was to be able to reach out and say, we need to find out the very best way to do this protocol, or the very best way to improve quality. And they talked about the sharing that happens between. And today here at Mission, we do that with our hospitals and our clinics. But to think about having a group across the country where you can reach out and say, help, I need some information, or have you tried this? They described multiple examples of how they were getting help and support as opposed to told to do certain things, because they said, we're accountable for our community. We need to make sure our community is met, and that's the expectation that HCA has of us.
Nice. Any other thoughts about that?
Just two things I would share is one of the leaders at one of our sessions, she had an iMobile phone app, and she said, let me show you this. We're piloting this technology so that we can have quicker access to our patients, to their needs, and the device. And I said, well, I was drooling. I said, I want that. And she said, no, we're piloting this project, and then it rolls out. And the impact was it was going to save time for the caregivers so that they can also make quicker decisions that are more apt, not having to chase that data and that information. So to your point, Jill, they provided that technology piece that was broader and bigger that was going to go across all of HCA. That was a positive. And one last comment on this. There was a CNO that she was so gracious and was touring us. She turned around and she said, Karen, I know that the people back at Mission and Mission Health and in your community must be worried about going from a not-for-profit to a for-profit. She said, I have 20 years of experience. The last 6 or 7 years I've been with HCA. And I've got to tell you that there has been no difference with the focus on our patient quality, our outcomes, our experience, and the staff engagement. And she says, please go back and share that. So I wanted to make sure.
Offered that to you.
She did.
And you came away with the sense that that was truly supported not just by the local folks at St. David's, but by the more corporate or
Yes.
HCA folks also.
Yeah, what the story also says is that you can develop technologies at a local level, and if they work well, they can disseminate across the system. So that we can teach HCA things that HCA uses across the system, but then we've got 177 other hospitals that we can learn from too to get better and better.
When you all had a chance to see and hear part of the hospital issues, and we'll touch on the foundation issues shortly because I know there's lots of questions and concerns about that. But when you think about the things you learned in the hospital visits, what were you most surprised about? What struck you as I didn't expect to see there? What surprised you?
The culture.
The
It was
culture.
very reminiscent of what we have here, where a very caring culture, very a family feel, and that would be the term I would use. It was very, people were approachable, and we went to several facilities. You couldn't have staged that. You know, it was very authentic.
We were there for 2 full days and toured how many different sites?
What
would
was
you
it?
say?
At least three hospitals, and we spent a lot of time through multiple programs.
Yeah, I think that the staff, one hospital, as we walked down to tour towards I think it was the women's hospital, and everyone was ahead of me, and there was a staff member. She says, "Come here." She says, "Who are you with?" And she says, "Let me tell you about this place." And spontaneous again, and I said, "This is great." She had been there for maybe 25, 30 years,
Oh,
a
wow.
long time. And she says, "This is great. This is a great place to work." And then I had to hurry up and catch up before I got left in Texas. But it was really it was genuine. It was nice.
Excellent.
So
Any surprises from a clinical delivery, clinical program aspect that you were either impressed with or unaware of before we went?
So I was surprised by how similar they are to us and how big they are. So their women's program, they are deeply dedicated to the care of women. They they deliver 7,500 babies. At Mission Hospital, we deliver about 4,500. And they have a lot of high-risk moms in their community. So they have 9 maternal fetal specialists, the high-risk specialist. They have OB hospitalists, just like our patient safety program. They have 4 that are available at all times for any woman coming through. And what I was watching is this great personal touch with women, and supplemented with really strong, if you have an issue, if you're high risk, we'll make sure you're cared for. So I was surprised at how integrated that program was, and then how similar it was. I was taken back by that.
there was a 61-bed NICU at St. David's that we toured, and as we came out in the hallway, they had people that had been on their patient and family advisory council, and they had pictures of them now graduating from college. And I mean, similar to what we do with some of ours, but we put the smaller baby pictures when they're graduating from the NICU. And also at the Women's Hospital, they had a satellite NICU within the L&D suite, and the support services were very, very focused.
So I've heard lots of different programs which were similar to ours. What about the quality? Did you feel that the quality of care delivery, I mean, we have prided ourselves on that for many, many years. Mission Health has been a proven top 15 health system, which means we've had objective measures of our quality. We've gotten national awards 6 of the last 7 years, which is something personally as the Chief Medical Officer I'm exceptionally proud of, and I think all of us are here. Did you get a sense that HCA and St. David's in particular offers us similar kind of quality? Do we have things we can learn from them? What is HCA's focus on that?
Yeah.
It was very clear their focus is on quality. So before we went, we could see all of the awards they have won based on their safety. They're a top 50 hospital from health grades. They're a top 100 hospital, just like Mission Hospital. And they're a 5-star Medicare hospital, which is the highest level of quality and patient experience. What I was really impressed with is very, very few health systems around the country have been able to do this. They're what's called a Malcolm Baldrige Award winner, which means that's a quality that crosses both all industries and is highly competitive. you have to demonstrate consistent levels of quality and improvement and innovation that we'd aspire to. So it was fun to be with them because we could see a lot of the things that we're doing the same. But they had taken that to every area of their organization in a way that I think we'd love to be a Malcolm Baldrige
Yeah, we
Award
certainly
winner.
would. We certainly would. So I hear that, and part of me says, well, that's great, but we're not going to be sending our patients there to get the care. It's glad to know that if we're in the same family, we have people of similar kinds of reputation. But what do you take away by the fact that they're a quality organization? What does it give you any certain level of comfort of our progression of our relationship with HCA?
Yes, I think it was very supportive and very similar. Also that they had access to their data just as we do. And they had the support. If there were barriers, the information that was shared with me by those CNO, those nursing leaders, was that they are there to support. The divisional CNO goes out to support those member hospitals and each one of those divisional hospitals to say if there's hospitals that are struggling, why, and how can we share the best practices. So it's similar to us, and I got the impression that that would be across all HCA hospitals from a corporate or from a divisional to divisional level.
Yeah, one of the things that we had
from a board perspective, we were interested in finding out, are the representations, the promises that HCA is making to us, did that really happen at other places where they were? And this came across like crazy.
And you had that same sense too, Janice?
Oh, I definitely. I felt that they were extremely good partners, and they would be extremely good partners with us here in this region, and that's what impressed me about their foundation as well. And if we could go to that topic for just a minute, since that's my
your
wheelhouse.
area of expertise, right? And your charge for the community, which I think is important.
Well, we visited with their foundation, and their foundation has about the same amount of resources that we will have as a result of this arrangement if it goes through. And so their foundation was very much in alignment with what we think the Dogwood Health Trust will be. It is based on social determinants of health, and that means the things that make people actually sick. And it's not based on health care. It's based on things like poverty, food insufficiency, education. Your zip code means more about your health care, your actual health, a lot of times than anything else that is happening to you in the world. So it was very important that we learned from them about what they did in the region, not just Austin specific, because they covered about 5 counties, and they were very, very prevalent partners with the communities that they served. And can I?
Yeah. Let me just make one comment so that we make sure everyone appreciates what our foundation, what it's about, how we'll be created, and then how we'll then address these social determinants of health, which you've touched on, which I think is critical, and we need to spend a considerable amount of time talking about that. But so people are clear, we are going to take the proceeds of the sale of the health system, and that considerable amount of money will be turned into a community foundation, which we have named the Dogwood Health Trust.
Right, exactly.
And which I am extremely, and I say this genuinely and sincerely, proud to have you as the inaugural chairperson.
Thank
You've been a tremendous supporter of so many efforts in our community, you and your family, and you are from the area, you know the people, and I can't imagine having a better person to help us get this kicked off. So I just want people to hear my personal endorsement of you.
Well, thank you. Thank you.
Unsolicited, by the way.
I'll pay
And then
you
that money will be invested, and the
Right,
proceeds
exactly.
of that investment will be put back into the community.
Right.
And that has, how much money will that be annually? Do we have any rough idea?
We think, based upon what we think we will be receiving, $50 to $100 million per year in the region. Okay, so when
For the 18-county region?
For the 18-county region, it is not Buncombe County specific. It will be regionally distributed to help people throughout the region. We will have lots and lots of partners. We will go to those people in their specific communities, listen to what their needs are, and help them solve the problems in their communities. We won't, we won't be dictating to them what they need. They will be coming to us, and we will try to solve things together.
And as we talk to them, we learned some critical things about how they set up their foundation.
Right.
John, maybe you have some comments about the needs assessment that they suggested we complete?
Well, they said the first three things you ought to do is, first of all, be very clear on what your mission is, and be very clear on what the strategic plan is to achieve that mission. Then go out and listen to people in the community about not only what their needs are, assessing what their needs are, but also assess their strengths, because every disadvantaged community has at least some strengths, and those strengths are often in the people and in the nonprofit institutions in those communities. And so that's where our foundation is going to work through the local people, work through the local not-for-profits, but with a strategy to improve the health in the region. And the mission of Dogwood Health Trust is to improve the health of the people and communities, all the people and communities in Western North Carolina. This will be the largest foundation per capita. That means we've got about 900,000 people in these 18 counties. And when you put the amount of money that the foundation will have to those people, it'll be the largest per capita in the country.
Wow, I think that, to me, as I think about this deal, is truly the most transformative opportunity that we have, really to make an impact on some of the issues that we see and address daily when we provide care at Mission Health System and throughout our member hospitals, but not addressing the illness episodes, but creating wellness lifestyles to address a lot of these. And I want to touch on that in a little bit more in a second. I know a lot of people have concerns. You mentioned this won't be Buncombe-centric.
Right.
How will we structure the board or the foundation so that we can be sure that the entire community, our 18-county region, our friends, our families, our neighbors, actually benefit from the proceeds?
How will we structure?
So is there a board? Who's going to make the
Right.
decisions?
Okay,
Are you
very
going to
good.
be the queen of everything? What's the plan?
Okay. Well, first of all, we're in the very nascent beginnings of creating this board. So nascent stages of this board. We will be accepting nominations for board leadership. You can go to dogwoodhealthtrust.org. There is a criteria for board membership, and you can self-nominate, or you can, or someone who feels that another person would be a good board member can nominate that person. So that's up and running. So that's dogwoodhealthtrust.org. So you can do that way. We want to have geographic coverage of our board members, so they won't all be from one area. We will have a lot of different board members, but they have to have some expertise. They have to understand that they have to serve the entire region. They can't be just a spokesperson for their particular community. They have to have a certain skill set that understands how to operate in a board setting. They have to understand that we will be looking at the entire region and working toward those goals of social determinants of health. It'll take a long time and a lot of board commitment time. So it's not something to be engaged in lightly, because we will want them to serve us well, and it'll take a lot of time. So
Tremendous responsibility.
a
for the board
tremendous
members.
responsibility.
And
right.
Selfless visionaries who put the community's interests first,
Exactly.
and the community meaning the broad community.
Right.
Diverse skill set, diverse demographic representation, and I thought I heard you say also representatives widely, but not necessarily from every community.
Well, our board will probably not have a board member from every county, from all 18 counties, because we will have a board that's capped at 15 board members. But we will certainly not ignore those other counties.
And from what I remember, John, maybe you can comment on this. We will have some ways of getting additional diverse representation and input into the early stages of the board work, so that while there may not be board members from every area, we'll have more than adequate input from the variety of communities.
Right, and one of the things that we learned at St. David's and from other people we've talked to is go slowly on picking the board members, because it's really important that those who come on recognize what the mission is, what we're trying to do, and who, in essence, buy into that
Sure.
and work together to achieve the purpose of improving the health of the people and communities in the region.
So Janice, you touched briefly on the social determinants of health, which is sort of a mouthful for most
Right,
people
it
who
is,
don't
it
live in
is.
our healthcare world.
Right, right.
We tend to think of healthcare being delivered at the hospital and healthcare
Right,
being
right.
delivered in doctors' offices and
That's
healthcare being delivered by nurses. I think it's important that we talk a little bit about the difference between addressing the social determinants,
Right, okay.
which take place outside, and perhaps our two nurses here can help us understand these differences a little bit. When I say social determinants of health, what do you think of, Jill?
The social determinants of health are critical, and both Karen and I have been nurses for several decades. And I remember one of the first things I learned in nursing school was how important it was to make sure that individuals weren't hungry, that they
Right.
had homes, that you could provide them a safe environment that's free of violence. When you think about those things which most of us take for granted, but when we look at our communities and individuals, if you don't have that support, if you don't have support in assuring that you know your children are going to be fed well, you know that you're going to be able to house them effectively, and that you're able to have gainful employment, those things make it very difficult to get a healthy child, to have the right starts, to be a healthy member of the community. So social determinants of health are critically important, and every day, and Karen can attest to this, every day, and you can, at Mission Hospital, we serve people that have tremendous pain and suffering because we didn't address their social determinants of health early on.
So why aren't we addressing those?
I think some of the challenges we have is if you're in a facility and you're trying to make sure there's transitions of care so that that person can get back to their home and into their environment. If that's not addressed because that's out of our scope or we don't have those resources, then those patients will frequently come back for another episode of care, and so we have to supply that or meet that need, and we are unable to do that as a hospital or a health
So
system.
concrete issues like if a patient lives at home and doesn't have air conditioning,
Yeah.
or a refrigerator to put their
Yes.
insulin in, or food on their table, transportation to the
Right.
doctor's office, education to know what the right things
Exactly.
are. And as much as, I dare say, as much as we would like to be able to do that now as a
Yeah.
health system, that's frankly not our charge.
Right.
And we, in this era of limited resources, we just haven't been able to do
Right.
that. So if that's the case, and so the foundation can do that, what will be the mechanisms by which the foundation does that?
Okay. Oh, okay. I have.
Can you answer that for us?
Yes, I
All
can.
right.
Okay. Well, first of all, we have a lot of strong nonprofits and health departments and other agencies, governmental agencies in our 18 counties. Those will be our partners. We will partner with them to see what the needs are, how we can best help them and serve them with resources that will actually address these issues and not just put a Band-Aid on them. Let me just give you an example.
I was going to say, did we learn anything from our
That's
site
exactly.
visits?
That's what I'm going to tell you about
Perfect.
St. David's. Okay, they have tooth buses, and they have more tooth buses than anybody in the country. They have 9, and these
Tooth bus being our mobile dentist office.
our mobile dentists, and they concentrate on children and on young children, elementary school children. They serve in that region 75 schools a year approximately. They go to these schools, they do exams on the students, the children, and then they get parental approval. They go back to those schools and actually do all their dental care for these children for nothing. They do it for free. This is part of their charge from the foundation. They have found that when they did a survey a few years ago, that children that miss school 45% of the reasons that they missed school was because of dental pain, for tooth pain and dental problems. They went back a few years later after the tooth buses had been so successful, and that wasn't even on the radar screen, or very small percentage of the students missed because of tooth problems or
That's
toothaches or
remarkable.
whatever.
That's great.
It's remarkable. The other thing that they did is they did not allow the parents to take off work or come and be with the students, because they said the parents scared the students, because the students weren't afraid of the dentist before. The parents gave them all this angst and anxiety. But the other thing is that was also an economic factor. When you take parents away from their work to be with the students, they weren't earning, their paycheck, or they had, many of them had to take off from an hourly position and couldn't get pay. So they spend $8 million in their community every year for these tooth buses, and that's a remarkable thing for their communities. And the thing that we know about is dental health in our rural communities in particular is an obstacle for us, and also for the uninsured and the elderly. And so this might be something that we could work with in our rural communities. Now, I don't think we're going to be running or operating the tooth buses, because we're not an operating foundation. But we could do similar types of programs. They help with food insecurity by helping with organizations like the Manna Food Bank and things like that. So these are things where they meet people where they live and create a better opportunity for them to succeed and be healthy. And that's what we want to do.
John, you were there too. What impressed you about the work?
Well, this is a wonderful, wonderful story, and it has many lessons. One of the lessons is on the social determinants of health. What we know is that people who are less educated likely or have more health problems.
Right.
So they went upstream from there and found that, well, why aren't they getting educated? One was that the children weren't going to school. Why weren't they going to school? They weren't going to school because of dental problems. Well, let's do something about that.
Right.
So that's an example of the social determinants. The second lesson, though, was that they measured what the outcome was.
Yes. Mm-hmm.
This was tooth problems were the number one reason why kids weren't going to school when they first started. Now, it's not even on the list of the top 15.
Yeah.
So one of the things we learned from the foundation was, if you can't measure it, you can't manage it. You need to have measurable outcomes to show that you're really having an effect.
Yeah, it's really no different than what we do on the hospital side.
Right.
But it's similar principles. I was equally impressed by that story. I was also impressed by some of the other pillars of their programs. As I recall, they had a 3-pillared approach. Not that we will have a similar one, but they looked at their goal, big audacious goal, was to be the healthiest community in the world. And when you have that kind of money you can invest, you can set audacious goals.
We're going to be
like
healthiest community in the universe.
There you go. Perfect. Fantastic. And their goals were healthy people, healthy places, and healthy care.
Yeah.
And so that was how they did it. And I assume that in our preliminary work, as we do our needs assessment, getting input from the community, looking at both the needs and the strengths of the community, we will create a similar set, as you alluded to. Tell them what you're going to do, tell them what we're not going to do, and then we will focus these efforts so that we can be successful in that regard. Any additional comments about that?
I just heard from your team that was talking to the foundation that they were very transparent, sharing things that worked, but also lessons learned. And that was what I also saw from our visit as well. There was a transparency there of truly saying, this was successful, and this is something that we learned was not as successful, and you may want to do it differently. Was that not true?
Yes, they were very forthcoming on things that worked and didn't work, and going forward with the Dogwood Health Trust, we know that we have a lot of work to do to get things right when we go out there to present our grant making process or whatever we're going to do. But I think that the couple of things that they told us from St. David's is be patient, make sure that you concentrate on the correct things, that you don't get too wide and so broad that you can't make a difference with anything. Make sure that you understand that this is a journey, and we have it's not we're going to look at things that happen over a 20-year time span. We can't we're not going to say try it 1 year and we're done. We're gonna do things that are very that take a long time to measure what happens, but we hope it's it's going to be for the best for the communities. So.
Yeah. And 2 other lessons that we learned were, 1, don't be afraid to take risk.
Right.
You've got all this money. Don't just put it on safe bets. Put it on something that might really pay off. It may fail, but it might really, really pay off. And then the second additional lesson was, you're doing this not only for the communities involved, but you're also doing this for what they call the field. That is, there are a lot of these foundations across the country. If you learn something, you can share it and share it with them.
That's good.
They emphasize the need for capacity building in the community. Tell us a little bit more about what that means.
Since, as Janice points out, we will, and St. David's does, work through the not-for-profits in the community. But in a lot of cases, those are underfunded, they're understaffed, they don't have the expertise, they don't have the communications capability or the managerial capability. And so one of the things that St. David's does is train people, put resources into building that capacity to communicate, to be able to administer grants, to be able to manage, and to be able to get out in the field.
I think that's
great.
critical, because it's sort of like the old biblical axiom.
Teaching the fish, yeah.
Exactly.
Yeah.
You can blind fish or teach them how to fish, and that's part of the goal. We need to work on both of those. I want to make some comments. It looks like we're about 2/3 of the way through our feed tonight. We've been getting a lot of questions which look like they're from team members of ours, and we're very interested in getting those answered. We'll touch on some of them, but for the most part, those we'll have separate team member forums where we can answer those in detail. So be patient with me as we carry on the conversation tonight. Other thoughts about the leadership of the foundation, other thoughts of things that, I know one question I really wanted to emphasize, and I'm glad I remembered, is I've heard lots of people express a concern that the indigent in our community may not have access to health care, and that they're concerned that the foundation will be paying for that health care. Do we have any comments or
Sure. Yeah,
reassurances for our community?
Okay. Well, first of all, and Jill and Karen can answer that question, but HCA has a charity policy that is equal or maybe even a little bit better than missions. First of all, they will take care of the poor and those people that come into our doors. That's important, and that was important for the board, for the mission board, and when we talked with HCA, we want to make sure that nobody is left behind on the healthcare continuum. That was never our intent, to leave anyone behind in that, and HCA has assured us that that's not going to happen. The fact of the matter about the Dogwood Health Trust is that we probably will not be paying for insurance. That's a governmental function. That's not or a private individual function, and that's not what we do. What we will do is try to keep people out of the hospital or needing health care altogether. So that's our.
I think that's key to emphasize that
Yeah.
there is the HCA company, which Mission Health will be part of, will be separate and distinct and completely independent from our foundation.
Right, exactly.
And that the foundation will be a community-based effort
Correct.
designed at addressing those factors which cause illness and
Right.
cause people the heartache that we
Exactly.
treat at the health system.
Right,
And that
right.
HCA will fulfill its obligation to the community by continuing to provide the charity care for those who are not as blessed as some of us are.
And Karen and I saw that from the
Firsthand.
hospital side. We checked, because for us here at Mission, being able to be available for everyone, and we know what a privilege it is to serve every individual, we kept checking through the day about their charity policies and were they open and embracing everyone, and time and time again, it was reinforced to me that they're living that value. And it was, for them, even the question was kind of unusual because they said, well, of course.
As I remember, they said they're the largest Medicaid provider in the Austin region. And for those of you who don't know, Austin has about, I think it was 2 million people in that community.
It's large.
It's much larger than ours. And it's a competitive healthcare environment with many different systems. They have a little bit different market than we do. So there's some things that aren't the same, but the one thing that is the same was that cultural emphasis on providing high quality care for all those that come to their doors, which was very, very
We
very
saw that with the
reassuring.
Women's Hospital, when the
Yes.
OB emergency department, and although I did not go through the emergency department for St. David's Medical Center, the staff shared that they have the same open door and they treat whoever shows up, and that's their mission.
A couple questions about nursing issues that the folks are asking. One, nursing ratios and staffing. Were you comfortable with how they
Yes.
treated their nurses?
Yes, that was one of my big focuses. St. David's had a waiting list for hiring, so I was really tuned in. I said, tell me more. And some of the things that we had been discussing with our HR department here, they had instituted, so I gathered some information. They were doing anticipatory hiring based on an algorithm for anticipating vacancies. They also had nurse externs, which we're rolling out thanks to the support of Ron and Jill and our leaders here, and Kathy Guyette at Mission Health. And they also were focused on a SNAP program. So there's some specific things. Their ratios were the same as what we have here, and as far as patient care to nurse. And they really did not have at that time, they may have in the past, but they did not have the strenuous vacancy that sometimes that we face here that we're working on.
And patient experience?
Yeah, their target is the 85th percent, or their target is 85th, and they're exceeding that, and now they're going to adjust it to the 90th.
So meaning when you compare them
They're-
to all the other hospitals in the country, they want to be better than 85% of them.
Yes. So I was very
So
interested.
we'll have to lower our standards by 5%. Because we want to be 90th percent. That's okay.
There we go. But they were very focused. They were doing the rounds, leader rounding, like we do with our, we have a tablet now that the nurse leader goes and talks to patients, and they have had that, and they added some questions, and so I learned that. They really had it hardwired. They also focused on staff engagement. We use Standout, which is a tool that has been very positive for our teams. What they've done is they meet monthly with their staff, and they base on how large a scope you have, and sometimes it's monthly, every other month, or by quarter. And they've have this data hardwired, which I learned some things that we can improve on from that. Like, how did you do that with the data?
So what we felt as you walked through the doors and as we went into multiple units, there was a real camaraderie, a real care between the clinicians and the environmental service technicians, which are the housekeepers, and people were working as a team, and they came up to us and just started talking about that. And you also I saw multiple times how compassionate and gentle they were with visitors, family members, and with patients. It was an esprit de corps that is very consistent with who we are and assuring that each person is getting their needs met. We learned some things from them, and they learned some things from
Yes.
Karen in
Yes.
terms of how to create the very best ways to deliver care.
And you're confident that this relationship, both at the hospital and the foundation level, will be a new open door for two-way communication to share
I
these
have
things?
their emails, business cards, and they have
Nice.
mine, and we have a support group already. So
And the foundation people offer to all of
Oh,
us,
yes.
Yes.
back and forth.
very
Oh,
open.
yes, we've,
And this is one of many, many hospitals in their health system with whom we'll be able to forge these kinds of relationships. So I think that's one of the nicest benefits of this is we become part of a bigger family, lots of diverse experiences. Most of what we go through in our communities and in our healthcare delivery system, other people have experienced, and to be able to draw on those relationships and learn and teach and share it's exciting. It makes it rewarding.
And they're working. There's some magnet facilities within their system, and their pathway hospitals, which is a designation of nursing excellence. They also use shared governance so that the frontline staff are empowered to be a part of decisions, and that's been cascaded all throughout the organization. And they shared with me a toolkit, so when they have best practices, they make it available throughout.
So
it's very
lots of
good.
nursing efforts, specific nursing focus efforts to foster career development,
Yes.
retention, job satisfaction.
They've invested heavily in their new graduates and nurses that are coming on and being hired to say, what is your goal? Is your dream to go into leadership? They've developed a pathway so they can help them facilitate that. I want to become a clinical nurse specialist or family nurse practitioner, or I want to be a preceptor. They have different pathways that they're developing so they can meet the needs of those individuals.
So that's great if you're a nurse, okay. What does that mean to me if I'm the patient?
Oh, better care, because the more we have happy staff and satisfied staff that are their needs are being met to grow and be more trained and have that evidence-based knowledge at the tip of their fingers, the outcomes for the patients, which they measure, and it did show that those outcomes are evident.
You know, you're talking to two nurses here.
Yeah, I get excited.
And so
Very
when you
aware
ask
of
how
that.
important is nursing, nursing is critical to the team and all members of our team.
It is, yeah.
And when you look at our talented nurses here at Mission Hospital and Mission Health throughout all of our clinics and hospitals, with Kathy Guyette's leadership and Karen's leadership and our presidency knows, a nurse really coordinates the care, assures that you have the right compassionate care, that it's all linking together. And we're facing as a nation a shortage that you have to develop and create great ways to help nurses develop. And with Karen's leadership and Kathy Guyette's leadership, I see that happening at Mission.
Yeah.
And Karen just described what they were doing at St. David's.
Do you think it's safe to say that that translates beyond the nursing staff?
We
Absolutely.
saw it. We saw
Into
it.
pharmacy and other folks?
Respiratory, into PT, OT, and we met some of those people at the rehab hospital and saw that engagement
That's
on
great.
their part.
So you mentioned the rehab hospital. We received a question on our feed about what will happen to care partners. I know that's not generally the import of tonight's conversation, but I think it's worth addressing. Any comments?
Oh, you bet. Care Partners is us. They're your mission. And they're part of the transaction going to HCA if this becomes culminated. It's really important. Every day I see Karen and her nursing team and our care managers. We have to have great care that's happening in the home and in the outpatient rehab center. And in the all the services, the hospice units. So together, we're one team taking care of each person and their family. I can't imagine not having a strong connection to Care Partners, and we will. For us, it'll continue today. I think it'll actually strengthen us. And Care Partners is so good at home health, hospice, rehab. I suspect they'll be a great teacher for other organizations
Yes.
across the
Absolutely
country.
right about that. They have some of the best outcomes in the country.
They're great.
In that area.
They
Along those similar lines, we talked about care partners. What about our rural members? Any impact? We know the foundation will be there to address the needs of the entire 18 county region. But what about how will this affect our member hospitals?
They are us. We're working together as a team, continuing to serve together. And to their specific needs, Kathy Guyette took a team to visit a HCA rural facility, and I think we're having another Facebook Live,
exactly right.
which will be all focused on the care in rural communities and how they are presently doing it. And so I think Kathy's going to be in a
Exactly
great
right. That'll be one
position
of our
to do
upcoming series.
firsthand information of what it looked like.
Right. Yeah, and that visit was equally well received. I think one of my biggest impressions when we came back was sort of that. So we had about a 13-member team that went between board members
Right.
and physicians and nurses and other folks in the hospital, and the universal feeling of, wow, this feels good. The people felt good about what they're doing. We feel this is a good relationship. It's, we make our decisions. I sort of make my decisions in a two-pronged way. One is based on analytical means.
Right.
And others less on a quantitative, but more on a qualitative, visceral gut feel about how it felt. And felt, you can read about the metrics, but you have to be there to feel the others. And I hope I'm not speaking for everyone. Maybe I am, but if you felt the same, I'd love to hear that.
I did. I felt a connection, and I felt a sincerity and authenticity, and that's what I think. You can have the metrics, but you can get those metrics by numerous ways. But I felt that it was a team approach, and people felt cared for, and I saw them delivering compassionate care as I watched them interact with some of the patients and the families.
Great.
So,
And we had Dr. Alex Schneider, our Chief of Staff, Dr. Don Gajewski, our leader of our cancer programs. They were also with us, Dr. Susan Mims. Universally, all of us had this conversation as we got back on the bus at the end of the day about both the quality that was being provided, the sense of team, and the real focus on patients. To a person, we could feel it. It was real.
Dr. Mims made a comment. She said that she and Dr. DiRienzo got in the car with the CMO so they could pin him down, separate from the rest of us on the bus being transported. And she said it was very authentic and it was the real thing. So
Dr. Mims being our Chief of Pediatrics,
yes,
and Dr. DiRienzo, our Chief Quality Officer.
yes.
Yeah.
So,
Good. So we're sort of nearing the end of our time. I want to see if people have additional things they want to make sure that we let our Facebook friends be aware of, and then we'll wrap up with a summary and some
I have a
closing
piece
comments.
since I've been to the site visit. It was, to your point, I could feel the difference, and being very intuitive, I wanted to be able to poke holes in it if I could. They faced many of the same challenges, but I saw that they were delivering the same type of high quality care, and it wasn't on the backs of any one person. They were doing it with the right motives and the right goals. So.
Janice?
Based on my conversations with the staff and the board of the foundation, it gives me great hope, and it gives me great excitement to think about what this foundation can do for Western North Carolina. I came back thinking about the possibilities of change that we could make in the counties and changes in the lives of our citizens. This is just going to be fantastic, and we have to look at this with our eyes open, and hopefully our hearts will be full when we finish. When at the end of the day, when we say this is what our community received from the Dogwood Health Trust.
Fantastic. Jill?
You know, at Mission, I think I speak for all of us that it's a privilege to serve each patient and their family, and we hold that trust very dear. What I saw at the site visit was a group of people and an organization that was doing exactly the same thing, and it actually gave me inspiration and hope that we'll learn together how to do that even more effectively. And I couldn't have said it better than both of you. I was quite joyful at the site visit in terms of what's the opportunity for us to even do it better than we're doing it today.
John?
Yeah, on behalf of the board, I went with one big question. After joining HCA Healthcare, did quality get better? Did access get better? Or did it get worse? Did the foundation do what it said it was going to do? And in both those cases, the answer is a resounding yes. It got better, and it did what it said it was going to do.
Fantastic. Well, I want to thank you all for taking the time to join me and share our stories about our site visit. I want to tell our viewers that we have a couple of next steps in the process. I know people are curious about what's going to happen. First and foremost, we're hoping to come to some terms in the next near future. Let's leave it at that with HCA. Terms being, what will our relationship look like? Once we come to an agreement with HCA, we'll go before the State Attorney General to have this reviewed from a regulatory point of view, and there will be also some federal regulations that are reviewed. And if that passes, we hope that sometime towards the end of the year that we would close the deal as we move forward. We want your questions to be answered. Please go to our websites. We have two, missionhealthforward.org, where there's a host of these questions that we've seen tonight and others that can be answered. And we're trying to be as transparent as we possibly can. And then dogwoodhealthtrust.org, where you can get information about this fantastic foundation and find applications and nominations for potential board members. So on behalf of our group, I want to thank you all for joining us and wish you a very good night.
Thank you.
Thank you.